40% of our general population is hypertensive now.
Does that mean everyone needs to get screened?
All adults beyond 18 years of age should be screened annually because now age is no bar for hypertension.
Suppose someone measured the BP this morning, it came out to be slightly high and they are on a medicine. Is it safe to go to the gym that day?
If you have a BP recorded as 180 or 190, the systolic one, then you should avoid because in the gym, whenever you exercise, the BP tends to rise.
What do you think is the reason for this early hypertension in the young age in India?
The younger population, we have seen that they are heavy smokers as well.
So if someone is smoking and they have high BP,
that's a terrific combo.
which oil is safe for BP or for heart health?
We always recommend a mix of different oils. It is not just one oil has been tailor-made for your BP health or heart health. Eat everything. You should eat in moderation and enjoy life as the best.
Hello everyone, this is Khushbu Agarwal, founder at Zyla Health. Warm welcome to the 11th episode of Conversations with Zyla. And given that we celebrated World Hypertension Day in May 2025, today's topic is of extreme relevance. Today we're talking about pressure points keeping BP in check. Our data at Zyla shows that up to 20% of people living in corporate India have hypertension, which is high BP, and another 40% have prehypertension, which is borderline BP. So what other better day to speak about this than today? It's my extreme privilege of honoring this stage today with Dr. Aseem Dhall, one of India's leading cardiologists with over 33 years of experience. Welcome, Dr. Dhall, to Conversations with Zyla. Currently, Dr. Dhall is the Director and Head of Cardiology at Indian Spinal Injuries Centre, New Delhi. He's an alum of the prestigious PGIMS Rohtak and King George's Medical College, Lucknow. Dr. Dhall, a bright student throughout his career, has won multiple gold medals and has been trained internationally at the University of Southampton, UK as well. Dr. Dhall has 25,000 plus cardiac procedures under his belt, which he has performed to save many, many lives. Dr. Dhall, what a pleasure to host you today at this show.
Thank you.
Okay, Dr. Dhall, so before we start, we have a ritual at Conversations with Zyla that we start with a rapid fire. It helps our audience gather the most from your years and years of career and knowledge. So I'll be asking a few questions. If you can answer those with a yes, no, that would be great. The first one is, only people above 50 need to worry about BP.
No.
Fit people can't have high blood pressure.
No.
If you don't have symptoms, your BP must be fine.
No.
Okay. Coffee and tea increase BP.
Yes.
Stress is the number one cause of high BP.
Yes.
Walking 10,000 steps a day is enough to prevent blood pressure.
No.
You can control your blood pressure just with yoga and diet.
No.
Home BP monitoring is not reliable.
No.
Pink salt is better than regular salt.
In some ways, yes.
Okay, great, Dr. Dhall. A lot of myths busted there. Thank you so much for sharing that with our audience. And now we get to the real meat. Blood pressure has been a very less spoken about, I would say, health evil of the society. We see a number of people living with it undiagnosed for years and years. So, Dr. Dhall, we're also seeing a rising trend in the 25 to 35-year-olds now, very relevant for a lot of our audience logging in today. What do you think is the reason for this early hypertension, if we may call it, in the young age in India?
So I feel the stress is the number one factor in such age groups. There's a lot of stress in the younger population, like the stress of job, the family stress. Then there is a stress to give the good livelihood to the family. So there are so many stresses and strains in life. And besides this, the younger population, we have seen that they are heavy smokers as well. So, and besides all these factors, the general factors which contribute in our younger population include obesity, unhealthy dietary habits. They keep on eating fast food, fried food, and they don't take care of their health. and associated diseases which are quite common in this younger population, like diabetes or kidney disease. All these factors are quite contributory and are maintaining this thing.
Got it, Dr. Dhall. So what you're saying is that apart from stress, there's also smoking and poor lifestyle or diet, which leads to this surge in high BP in the younger population. And Dr. Dhall, also understanding that BP is quite asymptomatic. We don't see symptoms of BP like we see of, say, a diabetes or other diseases, right? So do you think asymptomatic blood pressure is also dangerous, and what guidance should we give?
Yeah, majority of the patients do not have symptoms, surprisingly. The only symptom which a patient comes with is headache. So patients who are chronic hypertensive, they usually don't have symptoms. But then that doesn't mean that this is a benign phenomena, and all hypertensions should be looked into with caution, and they should be treated. Like, there are so many dangerous complications which hypertension can lead to. Say, for the brain, if the artery ruptures in the brain, it can lead to severe hemorrhage in the brain. It can cause dementia, it can cause cognitive disorders, it can cause visual loss in some patients. Then the most important organ which is involved is kidney. So it can cause severe kidney disease. In heart, it can cause left ventricular hypertrophy, it can cause heart attacks, it can cause hypertension. So, and then it can cause peripheral vascular disease. So no organ is exempt from this. So if it is not controlled in due course of time, it can create havoc to your body.
Got it. And Dr. Aseem, you touched upon a very important myth, which was BP impacts the kidneys. I think most of the people think that high blood pressure mainly impacts the heart. You did mention that it impacts the kidneys also. If in very simple language, you could explain to our audience here that why is high blood pressure such a havoc? What is it really doing in the body?
So whenever there is blood pressure, there is increase in the pressure, increase in the pressure of the flow to the various organs of the body. If the blood flows at a very high pressure in the brain arteries, the brain artery walls can get weakened, and it will cause aneurysm formation. And subsequently, these aneurysms are known to rupture. We have seen so many young patients, so many of them, we feel that this may be a cardiac disease, but in reality, you have heard so many patients who go to gym and then collapse. Majority of these are cardiac in origin, but some patients, we have found out that they have aneurysm because of hypertension, and these aneurysms rupture and they cause intracerebral bleed. And when this happens, the patient suddenly collapses.
Okay. And how do we define an aneurysm in simple language?
Aneurysm is an outpouching of the wall of the artery because of a weakening of the wall.
Got it.
So the artery, it goes like this, but then because of weakening, because of the pressure, this outpouching occurs. When this outpouching occurs, the blood flows in this with pressure and it suddenly ruptures or bursts.
Got it.
And that is quite dangerous phenomenon.
So it's almost like, a water pipe which become weak.
Burst.
Yes, and it bursts.
Yes, it
Understood.
bursts.
Very clear. Thank you, Dr. Dhall, for that. So who should really get screened, right? Because you rightly said that there are people who do not know they have high BP and they may be collapsing in the gym because of an aneurysm, right? Which is a rupture of the artery because of high BP. So does that mean everyone needs to get screened? Who needs to get screened and how frequently?
Everyone needs to be screened. I would say all adults beyond 18 years of age should be screened annually. Secondly, whenever you go to a doctor, you should be checked for your blood pressure, because now age is no bar for hypertension. Thirdly, then there are certain risk factors. Patients who are previous hypertensives, patients who are obese, patients who have underlying disorders like diabetes, patients who have kidney diseases, patients who are smokers. So all risk factor patients and patients who have underlying diseases which make them more prone for hypertension. Those are the people who must be screened.
Got it. And it is the lowest cost screening that can be.
Blood pressure is such a simple phenomenon.
Yes.
Nobody takes a cost for checking your blood pressure also.
Exactly. Even if you don't have a BP monitor, you could go to a nearby pharmacy and they would check it at no cost.
Absolutely.
And a life saved there, right, with the right diagnosis. Great. And Dr. Dhall, if you're monitoring BP or screening for BP, what is the right time? Is morning BP better indicator or evening BP a better indicator?
So generally what happens is that the blood pressure starts rising for a few hours before we wake up. And then it starts getting higher and higher when we start working or we are doing our daily activities. And by afternoon or maybe in the evening when we try to wind up our work, then it starts decreasing. So this is the normal circadian rhythm of blood pressure. And we recommend recommendation is that twice you should be checking your blood pressure, once in the morning and once in the evening. And for people who are hypertensive, all readings, and then we take an average of the readings, say over a 1 week period.
Got it. And then there is also a misnomer, I don't know if it's true, that most of the times you go to a doctor, you may have high BP because of stress. So what is your viewpoint on that?
Yeah, so that is called white coat hypertension, and that is office readings are majority of the times higher than the home readings. And some people do have this. So it is always better for them to monitor their BP at home only, because whenever they come to a doctor, it's going to be high, but they say their home readings are fine. So either their instrument is wrong, which has to be calibrated. Otherwise, if the instrument is fine, then we rely more on home readings in such patients. Because if we keep on giving higher and higher medicines, and this response is unpredictable. The white coat hypertension is unpredictable. In X patient, there may be 10-degree rise. In Y patient, there may be 20 or 30-degree rise. So the medicines won't work the same way.
Got it. So just last question, Dr. Dhall, and we've heard this very often, that is the manual BP monitor more reliable or the digital one more reliable? Or why is there a difference between the two sometimes?
We always recommend manual auscultatory method, which is more reliable. But then the home BP monitoring is fairly reliable. We have instruments which fairly record, it may be 10 millimeter of mercury lesser than the auscultatory method, but then they give a fair idea of what's going on.
So what you're saying is it could be slightly lower than the manual.
Lower.
Got it. Okay, great. Very, very clear, Dr. Dhall. Thank you so much for sharing insights on, the rising BP trends and the screening protocols. Now we'll touch upon one of the favorite topics of our audience of all times, which is the impact of diet on blood pressure. And we are living in India, a country of pappers, pickles, chutneys and chaat, right? We love our street food. Where do we draw the line, right? Is Chinese safe? Is street food safe? Is achar safe? Is chutney safe? Is everything unsafe? What is really your guidance as a cardiologist on this?
So I think it is not that X is safe or Y is safe. All have positives and negatives. But what I feel is that you have to have all these things in moderation. If you keep on daily consuming such articles, then it's chaos. Your blood sugar, your salt levels, your blood pressure levels will go out of control. So the recommended is that you should be having less than 5 grams of table salt per day.
Got it.
Or less than 2 grams of sodium content. So the most important thing I feel is that you should be seeing the labels of whatever you are eating. And per serving, if you find that the salt content is more than 100 grams, more than 100 grams, so it should not, more than 100 milligrams, so it should not be consumed. So less than 100 milligram per serving, you can still have it.
Okay, because you'll have multiple meals in the day.
You should always see the labels, because government has made it compulsory for the labeling.
Got it. Great. So moderation is the key here, Dr. Dhall says. And then we see that there are a number of food items, as you rightly mentioned, labels are critical. Things like protein powders, soup sachets, namkeens, which have hidden sodium, right? So the person will not realize that they may feel that this seems not so salty, but there is a lot of sodium in it. So what's our take on that, Dr. Dhall?
Yeah, absolutely. So that's why I said that you must read the labels. If you read the labels and if you find per serving content is okay, then you can consume it. Because majority of these have higher contents.
Right. So what's the guidance on sodium content per meal?
So sodium, because it don't mention sodium differently, it just mentions salt. So you have to see the salt content is less than 100, it's okay.
Got it. Okay. And is there any guidance on BP lowering food? So this is of course good guidance for someone trying to prevent hypertension. Someone already has high BP. So what is the guidance for their dietary habits on a daily basis? What should they be consuming?
So green leafy vegetables like spinach, carrot, broccoli, avocado, these are potassium rich fruits like watermelon, oranges, bananas. So they are quite helpful. Then you can say beetroot, berries are quite good. They are potassium rich and are sodium depleting.
Okay.
And then you can have the desi nuskas like haldi, turmeric, ginger. All these are quite helpful.
Got it. So potassium rich foods you're saying will help people living with BP, and they should include that in their ghar ka khana.
Right.
And then coming to one of the myths that we were trying to bust on pink salt versus normal salt. We get this question very, very often, Dr. Dhall. Which one is better, pink salt or normal salt?
So the pink salt or the Himalayan salt, what happens is that it is supposed to be a little better than the table salt in some ways, that it contains our majority of the trace elements like potassium, it contains calcium, it contains magnesium, besides other trace elements. So our body requires trace elements, and majority of the trace elements are present in pink salt. The most important ones I have enumerated. And because of this, they have the ability to say get digestion better, they have a better immunity coverage, or maybe other healths. But the disadvantage is that it does not have sodium. The sodium content doesn't have iodine. So the iodine content is better in the table salt, normal table salt. So if you see the Tata or salt and all, it has iodine. So people prefer those because it prevents thyroid disorders also. So that is the only disadvantage. But otherwise, because of its higher trace element content and better health, it is considered to be an edge. It has an edge over the table salt.
Got it. So while it has trace elements, normal salt is fortified with iodine, which prevents thyroid disorders. So is it fair to say that some people mix the two salts, so that's a best way
you can choose the best of the two.
Got it.
Of course.
Okay. And given a lot of culture of eating out and ordering out these days, Dr. Dhall, quite difficult, especially for, say, bachelorettes to avoid. What is your guidance on which foods to pick if you must eat out or order out?
Yeah, so there are certain important things when you go out. You should try to avoid fried and fatty foods. You can take grilled instead. Then you can choose not to eat mutton. You can eat fish or chicken. Among the vegetables, all vegetables are quite good, as I enumerated, spinach and all, carrots and all are good. So, and then among the drinks, if somebody wants drinks, unsweetened drinks are better, chaach or something like that, without salt, rather than taking high sweet drinks. And then you can have a low fat yogurt, which is quite good. But once a while, I feel that all these things are important in life because they need a change. Everyone needs a change.
Right.
So you can have all those things in moderation once a while. Should not be a routine.
So, but that's great insight, Dr. Dhall. What you're saying is you could eat out, you could order out, but choose your things, right? Yes. Well, the drink you're ordering, the foods you're ordering, the type of meat you're ordering. Great. And given we have a number of people joining us today, we see questions pouring in already. Please keep posting your questions in the chat. I'll just take a couple for now. So, Dr. Dhall, one of the questions we are getting on the screen is on diet again, which is with respect to the oil to be used. It's always a question we get. Which oil is safe for BP or for heart health?
So the recommendation is that some oils have some content which is good, the others have the other contents which are good. So a mix of oils, we always recommend a mix of different oils. It is not just one oil has been tailor-made for your BP health or heart health. You can choose different oils at different points of times.
Got it. And there's no particular oil.
There's no particular oil.
Got it.
Good.
You have to keep rotating.
You have to keep rotating.
We'll just take one more, Dr. Dhall, which is on the genetics aspect of high BP. If a parent has high blood pressure, is it necessary that the offspring or the kid will also end up with high blood pressure?
No, it is not a must. It is not a must because there are certain recessive genes. If the kid inherits recessive genes, then he may not get it. But yes, it's a genetic disease which runs in families. So he has a propensity for having it, but it is not a must.
Great. So there's hope there. Thank you, Dr. Dhall. We'll move on to the next segment. Please keep pouring in your questions meanwhile. The next one, Dr. Dhall, very, very critical in, I would say, the 21st century. And it is screens and sleep, right? So we all have seen this entire culture of OTT, scrolling, social media. We are continuously hooked to a phone or a laptop or a large TV screen. So is screen time, late night scrolling, late night binging on OTT, does that affect blood pressure?
Yes, increased screen time, late night seeing movies and late night screen, it is one of the predisposing factors in hypertension. And the reason for this is that all these activities tend to increase our sympathetic drive. And when our sympathetic drive increases, we tend to have higher heart rates and increase in blood pressure. And the second most important reason is that the screen emits blue light, and this blue light inhibits the melatonin, and which is the hormone which regulates our sleep cycle. So our sleep cycle is disturbed. It gives the blue light gives an appearance that we are we are living in a daylight. It gives you that we are in a daylight. So, and then, the quality of the sleep also matters. Once you are having more screen time, then whenever you sleep late, it will always be an uninterrupted sleep. Once there is an interrupted sleep and you keep on getting in the middle of the night, various times, your blood pressure, of course, is going to be on the higher side.
Got it. So, Dr. Dhall, just taking two tangents from the conversation we just hit, right? One is on the quality of content itself, right? Because social media, again, is known to create a lot of anxiety and we are always hooked. Everything is real-time exaggerated, 10x, and then presented. So, does the quality of content also impact your blood pressure?
More aggressive, because kids are seeing more aggressive ones, fighting scenes. So the system gets immune like that only. And those are the ones who become agitated later on in their lives.
And that increases anxiety.
All these factors are contributors for hypertension and disturbed life in the later ages.
Got it. So we must regulate the content we are watching, our family is watching, our kids are watching.
Absolutely.
And then the second tangent I wanted to pick, Dr. Dhall, is on the quality of sleep you mentioned, or ability to sleep well, ability to fall asleep. All of that also gets impacted, or say the number of sleeping hours itself, right? If I'm watching something till 2 a.m. and then I have office next morning at 8 a.m., I may sleep only 5 hours. So does that also then impact?
Yes. It is just not the number of hours which you sleep, but the quality of sleep is very important. So deep sleep is very important. You must go into deep sleep. If you don't go into deep sleep, and deep sleep is quite a good thing. So it gives you relaxation over a period of time.
And how does one know they went into deep sleep last night?
Nobody knows that. But the next time when you get up, you are tired when you are not in deep sleep.
So if you had deep sleep, you'll wake up more fresh?
More relaxed, more fresh.
Relaxed. Got it. Okay. And what number of hours do you recommend as, a senior cardiologist that one should have, to sleep every night for a healthy heart or low BP or normal BP?
So one should sleep for a minimum of 6 hours. Preferably 6 to 8 hours is good, but not less than 6 hours, definitely.
Got it. And any digital detox tips that you follow, Dr. Dhall, to keep your heart at bay?
Doctors don't follow any such tips. They are just the ones who can give tips to people.
Tips you would like to give then, Dr. Dhall.
Okay, I can give you tips. And the tips would include, you should be... I would say our life starts with phone. The moment we get up from the bed, phone is the first thing we see. Messages are the first things. And when we go to bed, before going to bed, we always see the phone and what messages we have missed during the day. So I would say, unwanted phone calls, unwanted notifications, which you don't want, just switch them off. You should have a family time with you for a couple of hours, right? And when you go to your room, I've seen so many friends of mine who have a zero tech in their room, no tech. They just go to their bedroom and then sleep and have a happy life.
Wow.
That's nirvana. Very rare, but they're not doctors.
Oh, they're not doctors. I was thinking, how can a cardiologist do that?
No, we can't do it. We can't switch off our mobiles. That's a tragedy. If we switch our mobiles, next day the patient is going to call, "Doc, we could not find you on the phone." So it's very difficult for a doctor to follow these rules, but then general public can for the betterment of their life.
So non-doctors, please follow the rules Dr. Dhall is mentioning. Great ones there, sir. Okay, great. So Dr. Dhall, we'll move on to the next segment, after sleep, which is again the third pillar of good health. We spoke about diet, sleep, and the third one, none other than fitness. So someone living with BP or someone at risk of BP, let's keep it as those two segments. What are the exercises that you would recommend, right? Given all of the calamities we see in the gym and so on, there's a lot of fear or confusion around what is healthy exercise. So what's your guidance there?
So the best exercise for cardiac patients is walking, brisk walking, cycling and swimming. These are the three best exercises. And then, of course, you need isometric exercises like muscle strengthening exercises, what people do in gym. They are also an important part of our curriculum.
Okay, and is this the same for anyone with high BP or at risk of high BP? It's the same?
Yes, it's the same, but only people who have high blood pressure, they should not be doing heavy weight lifting.
Got it.
Other exercises are very important.
Right. And if suppose someone measured the BP this morning, it came out to be slightly high and they are on a medicine, is it safe to go to the gym that day?
Well, that depends upon what levels they have. If you have a BP recorded as 180 or 190, the systolic one, then you should avoid, because in the gym, whenever you exercise, the BP tends to rise. If it rises beyond 200, which it is going to be, and then, as I said, the heart is at load, the brain arteries can rupture, and all those things can happen. So it is always better that your BP should be controlled.
Got it. Okay, the last one I have here, Dr. Dhall, is on how long before lifestyle changes, show up in BP readings. If someone's BP is high or borderline high and they make a lot of lifestyle changes, the ones you just mentioned around their diet, their sleep, their exercise, how long does it take to then that reflect in the BP reading?
Well, it takes, say, weeks to months.
Okay.
But consistency is the rule. It's not that you go out for a walk and next day you see your BP and you expect it to be normal. It has to be a consistent hard work from your end.
Got it. Okay, Dr. Dhall, we'll just pause for a couple of questions because I see many popping up on the screen here. So we'll take one on the BP levels itself, Dr. Dhall. And the question is, I think, a little bit... not one of the favorites of cardiologists, which is on the normal BP readings, right? What is really normal BP? While it said 120 by 80, is it a very exaggerated number? Is even 130 by 90 normal? I think that's a question that the person is trying to ask.
So the normal blood pressure is less than 120 and the diastolic less than 80. This is normal blood pressure.
Right.
Now the guidelines have simplified. For the benefit of the viewers, I would tell it's a simplified way of saying less than 120/80 is normal. 120 to 139 systolic and 80 to 89 diastolic is elevated BP. And beyond 140/90 is high BP.
Got it. Great. Thank you so much, Dr. Dhall. Very simply put, for the purpose of our audience, systolic is the upper number you see on a BP monitor. Diastolic is a lower number that you see on the BP monitor. We'll just take one more question here, Dr. Dhall, which is on the pulse rate. If I have high pulse rate but normal BP, is that okay?
No, it's not okay. The normal pulse rate is 60 to 100. But we put it 60 to 90 because beyond 90 it's on the higher range. And if the pulse remains on the higher range, then your heart has to work against that workload. And of course it is going to tire or it is going to affect over a later life. So your heart rate has to be controlled. It should be between 60 to 90. If you have a heart rate of beyond 90 or 100 at rest, that means you need to see your doctor.
Got it. And for the audience, can we explain in simple words, Dr. Dhall, once that what's the difference between BP and pulse?
So now the pulse is once you record here, and the BP is what you record here with the monitor.
Correct. Awesome. Okay, so the next question we have, the next segment that we'll get to now, Dr. Dhall, is on one of the very well-covered topics on Conversations with Zyla, which is alcohol and health issues, right? So we talk about alcohol and energy drinks both because sodium is a culprit here for the purpose of this discussion. Now, social drinking, a very common aspect today in India and globally. How much of it is okay? How much of it is safe? How much of alcohol is safe, according to you, Dr. Dhall?
So we say that alcohol in moderation is good, which means that those people who do not drink should not start drinking. Secondly, those who drink should drink in moderation.
And what about energy drinks, Dr. Dhall? Because some of them have a lot of sodium content. So which energy drinks should one take if...
So these energy drinks one should not take. In fact, kids during their exams and all, they start taking these energy drinks because they keep you wake up throughout the night and they have to cover the syllabus, the last end syllabus. So these are actually not recommended. And because of their high sodium content, because of their high sugar content, because of the high caffeine content. So all three are quite high and they are predisposing factors for hypertension. And the studies have shown that if you consume more than say 800 or 900 ml in a day, then these people can have some heart rhythm disturbances as well.
Okay.
Which we call as arrhythmias.
Okay. So the energy drinks quite popularized by a lot of media and celebrities should be taken in moderation.
Should be taken with a pinch of salt.
Metaphorically so. Otherwise they do more harm than good. Yeah. Okay, and you covered caffeine as a concept. I missed covering that earlier, Dr. Dhall. Thanks for bringing that up. So on caffeine as a topic, someone living with high BP or trying to avoid BP, how much caffeine is okay to take?
I would not quantify the caffeine because caffeine actually is good for GI purpose, but it causes a lot of gastritis. So once a patient starts taking, which one should not feel that caffeine is good for health or bad for health because it is individual variation which a person has to take. If a person can take two cups of coffee, that means he's fine, but some other people may be having some gastric irritation and then that causes other kinds of problems, some stress and all kinds of problems, and then he'll land up with blood pressure and different kinds of problems.
But if someone has high BP...
quantify how much caffeine is good or how much...
okay, so it's very individualized. That's great. But if someone has high BP, then they should limit the coffee intake, for example, to some extent?
Yes, I think so.
Got it. Okay. Great. So, Dr. Dhall, we'll now cover some critical numbers that our audience wants to know. That one is, what are the key guidelines to check BP at home? The do's and don'ts.
So, this is a very important question because checking your blood pressure in the right way is extremely important. So, it can be done either in supine position, which means that you are lying down flat, or it can be done in sitting position. Either way is okay. But if you do it in the supine position, then your blood pressure is say 1 to 5 degrees higher than the sitting one. Number 2, you should be sitting for 3 to 5 minutes before you start checking your blood pressure in a still position. Number 3, you should not be walking around before, you should not be consuming coffee or tea for half an hour before this checking of blood pressure. Number 4, your bladder should be empty. Should not be BP should not be checked with a full bladder. And then if you are sitting, then the blood pressure instrument should be at the level of your heart, whether you are lying down or whether you are sitting. Your blood pressure instrument should be at the center of the heart. And then the cuff size is very important. The cuff length and the cuff breadth, that is very important. So the cuff length should be around 75 to 100% of the arm circumference where you are putting that. And the cuff breadth should be 35 to 50% of your arm circumference. And then when you check your blood pressure, you have to, by auscultatory means, when a doctor checks a blood pressure, then the blood pressure, the systolic, we do it with the palpatory method, get a rough idea what is the systolic BP, and then we make the BP rise up to, the cuff inflate up to a slightly higher level than what we recorded it. And then gradually we decrease the levels and we hear the sounds by stethoscope and we come to know the blood pressure.
Got it. It's more scientific than how we measure it at
scientific. Home. But home recording, you can do it in a similar way. The other prerequisites are the same.
Got it.
The supine or lying down, bladder empty, quiet sitting for 3 to 5 minutes without after coming, not that you come from a walk and then you start measuring your blood pressure. It is going to be on the higher side.
Got it.
So
got it. Okay, and we spoke about BP monitors, Dr. Dhall. So which ones are recommended if I have to buy a BP monitor today because I got inspired by this podcast? Which one should I buy?
Not to take any names, but there's so many of them available in the market and they're all good.
Got it.
I mean, they give you a fair idea of blood pressure.
The digital ones,
right? The digital ones. And this is what we want.
Got it. Okay. So Dr. Dhall, a couple more questions I'm seeing popping on the screen. First one is on the link of smoking and blood pressure. Is smoking really a problem and does it cause high BP and why?
Yes, smoking is extremely one of the major factors of hypertension because smoking causes our arteries to constrict. Constriction means it causes the arteries to narrow down. And smoking, it damages the endothelium of the arteries, and once the endothelium gets damaged, all sorts of plaques, lipids, abnormal platelets, and all sorts of the abnormal particles flowing in the blood tend to accumulate at that point of time. If they accumulate in the heart arteries, then we call it plaques, which tend to rupture and cause heart attacks. So smoking is very dangerous and is one of the major factors besides stress, as I said, in our younger population.
So if someone is smoking and they have high BP,
that's a terrific combo.
So they should try to quit immediately.
They should try to
There is no healthy level of smoking, correct?
No, there is no healthy level of smoking.
And Dr. Dhall, why do high blood pressure and cholesterol appear together mostly in people?
Because all wrong things tend to accumulate at one point of time. So high BP, people who have high BP, why they have got high BP? One, it is a genetic predisposition. Secondly, they have done something which has caused them. What is that? A stress, smoking, bad habits, lack of physical activity. And once you have all these, they are the precursors for your high cholesterol levels. So they tend to combine.
And do we see high BP prevalence more in India than other countries? Has research shown something like that? Or
no, it's not like that. But yes, India is fast picking up. It has already become a diabetic capital. It is fast picking up in hypertension as well. And 40% of our general population is hypertensive now.
Yeah, we don't want to top those charts, but got it. Okay. Now, Dr. Dhall, moving on to a critical segment, which is blood pressure and heart attacks, right? So why is it that someone living with high BP for a long time tends to have a heart attack suddenly one night? And why does it happen early mornings mostly?
So, as I said, that this is the circadian rhythm. The blood pressure tends to be higher in the early morning hours. And this is the time when our hormones and cortisol levels are at its peak. And there is increase in the sympathetic drive because of all these things. So that is the reason why we have a tendency for a higher attacks early in the morning.
And someone living with high BP, they have a much higher chance of...
Yes, it is one of the predisposing factors for heart attack.
Okay. And which organ is more at risk, the heart or kidneys?
Both. Heart as well as kidneys. Both are equally affected.
Got it. We spoke about heart health quite extensively, now just moving gears to kidney health. If someone has chronic kidney disease to some extent, their filtration is impacted, what precautions do they need to take, or is there a range under which they should keep their BP?
So blood pressure is the most important thing to be checked in such patients. because if the blood pressure remains on the higher side, then that means that the kidney deterioration would occur at a very fast pace over a period of time. So the blood pressure should be kept less than 130 by 80 in such patients. It has to be a very stringent control of blood pressure. You can't take chances of 140/90, which we usually call as hypertensive. So in such patients like diabetics or in kidney diseases, we have to have a stringent control of blood pressure.
Got it. Now just moving on to our last segment, Dr. Dhall. I know it was World Hypertension Day, but would like to touch upon hypotension for a little while, because although it is rarely occurring, but it creates havocs in the lives of people who have it. So living with low BP, who's at risk and why does it happen?
So what is the definition of low BP? So many people come, BP low ho gaya. That doesn't mean that for some people, say for ladies, the blood pressure is 90 by 60. So that blood pressure is fine for them. We have to see what is the mean blood pressure and whether that blood pressure is perfusing our vital organs or not. And by perfusion, it means, what a rough guide is, if you are pouring good amount of urine, that means your vital organs, which is the most important of them is kidneys, are perfusing well. So low blood pressure is nothing in a normal person. Well, if the blood pressure is, say, the upper one is 70, that means it is quite low. But BP is maybe, we see lots of patients in the OPD will say 90 BP and lower one is 60. It is not low for them. It is a normal phenomena for them.
And what symptoms could tell them that actually it's going on the lower side and some intervention is needed?
Yes. So when a BP goes low, people start having fatigue. People start feeling low. They start feeling breathlessness on slight walking. They have sweating. So those are the signs of low perfusion. And these signs, if you detect, that means you must check your blood pressure at least.
Got it. Okay, great. So Dr. Dhall, one just last question, which I would like to ask is on the diagnostic test that you would recommend for someone, say above the age of 35 with borderline BP or high BP. What are the tests that they must get every year to ensure that their vital organs are safe?
So beyond 30 years of age, everyone should have a basic health checkup, which would include because there are so many tests which are available now, but the most important test would be a CBC, a KFT, LFT, urine routine examination, fasting lipid profile, and thyroid, and blood sugar, plus HbA1c. So these are the blood tests which are important. And then every person should have ECG and echocardiography. These are very important basic tests. And then depending upon the situation, what a person is having, depending upon the situation, he can have a treadmill test or other specialized tests as per the requirement or symptoms.
Got it. So these are specialized tests beyond the blood tests you mentioned. These are specialized tests for the heart.
For heart, ECG and echo are basic tests now, and they come in the category of
basic tests.
They come in the category of routine health care.
Great. And that's what we do for, most of our organizations and users as well. Great point, Dr. Dhall. And what about kidney? Just the kidney function test, the blood test is good enough?
The screening test, if you are doing, then KFT, urine routine examination is good enough.
So the urine routine would tell you if there is
some proteinuria or some glucose in urine.
Okay. And what do protein or glucose in urine signify, Dr. Dhall?
They signify some early abnormalities in kidneys. If there is proteinuria more than the recommended levels, microproteinuria is less than 150 per 24 hours. But if it is more than that, that means the kidneys are at load. And if it's showing sugar levels, that means you have to have your blood sugars checked.
Got it. Great. Okay, Dr. Dhall, we'll just take a couple of questions here on the screen. So the first one is on BP medicines. Which BP medicines are safe and, can they be taken for a lifetime? I'm sure you've got this question 1,000 times.
So nowadays, the latest medicines, all BP medicines have minimum side effects. And BP medicine, that is safe for a person which is controlling his blood pressure. So it is not that X is better than Y. whichever BP medicine is controlling your blood pressure, that is a good medicine for you. If one is good medicine for you, that doesn't mean the same is good for me as well. So it has to be checked. We have to see if that medicine does not cause you any side effects. All medicines have minimal side effects. They're good medicines and they're fairly good to control your blood pressure.
Got it.
And you can take them for lifelong.
Okay.
So long as, because as I said, there are minimal side effects now.
Great. So I'll ask a sub question, I think what the audience is wanting to hint. If someone is diagnosed with high BP and you said you take out the average of readings and then determine hypertension, you start them on a medicine, right? And then their BP starts coming in control. They also make the amazing lifestyle changes. Is there a way to get rid of that medicine, reduce that medicine ever?
Yes, you can reduce your BP medicine. It's not that you have to take it lifelong, because you see there are stresses and strains of life. And you can have, and BP is a dynamic phenomenon. It's not that blood pressure will remain static. So what happens in the initial phases, that you come to a doctor with a blood pressure, you start taking your medicines. At that point of time, you may be having some stresses which are unknown to the doctor, which are known to you, but probably you're not giving importance to them. And you start taking medicine. One fine day, those stresses are relieved, and you can very well get off your medicines.
But it will need the regular monitoring after that.
Yes, of course, they need regular monitoring. And if your blood pressure tends to be on the higher side after stopping medicines, then you have to restart them.
Got it. Okay, great. Dr. Dhall, the next one is on pregnancy and BP. What is a normal level of BP in pregnancy?
So the normal levels are same, as is 120 by 80. And the hypertension levels again are the same, 140 and 90. Those are the standard principles, whether a patient is pregnant or not.
Got it. But is it required to be more further deeply monitored during pregnancy? Or?
Yes, some patients have tendency for high BP during pregnancy. And if that is so, then you must consult your doctor, and there are certain specific medicines which need to be taken during pregnancy, because all medicines are not safe in pregnancy. So it is extremely important to visit the doctor and consult him or her, or gynecologist, whichever medicines should be given during the pregnancy, because they have all medicine, majority of them during pregnancy have iatrogenic effects, other kinds of genetic abnormalities and all those things.
A sub question there, Dr. Dhall, and then we'll go to the audience questions. I've also seen a lot of women these days being prescribed Ecosprin as a preventive or prophylactic medicine during pregnancy. Is that linked to preventing high BP?
No, that is not. Not for blood pressure. They're giving it for some other purpose, not for preventing hypertension.
So BP has to be separately monitored.
Yes, definitely.
Still. Got it. Okay. The next one is, why is my BP high during winters, and should I take extra medicine for it?
So in winters, what happens is that the arteries tend to narrow down. The arteries tend to constrict. And that is why your blood pressure tends to be on the higher side. And of course, you have to regularly monitor it. If you find it on the higher side, then you might have to step up your doses a little.
Okay, so meet your doctor and discuss and maybe take the average readings, as you said.
Right.
Okay. We'll take just one last one, Dr. Dhall, and it is basically saying, if I have a sudden reading of 180 by 120 and I didn't have BP earlier, should I take some medicine immediately?
So once you have to, if you have got a home reading of this, then you must go to the hospital, because 180 by 120 is an hypertensive emergency kind of a situation. So as I said, it can cause, because sudden rise in blood pressure, who is not a known hypertensive, can create so many problems. So this is a case who has to go to a hospital at least to check whether the blood pressure is really such high or not. And if it is high, then it has to be lowered urgently. Because to the
so walk to the
levels.
nearest hospital.
Walk to the nearest hospital or nursing home or clinic, wherever is possible.
Got it. Great. Just one last from my side, Dr. Dhall. We work with a lot of workplaces. What's your guidance on workplace BP prevention? Should there be some regular monitoring for the entire organization regularly? What would you guide there?
So nowadays, corporates have such good systems, and I'm sure you must also be having. They have coffee breaks. They have their gyms within the corporate areas.
Right.
So they have stress busters, which you keep on having seminars.
Right.
Then there are outings also, which are done for you, which are not for the doctors and all. Right. So I really, corporates are taking good care of their employees
Yes.
now, and I feel that, and they are given good food.
Yes.
No?
And I also feel, Dr. Dhall, in addition to all of this de-stressing activity, a quarterly BP monitoring activity on site in the office could be a great way to save lives, right? Because
So all corporates have some doctors on their panels.
Correct.
Who would be regularly coming, say, once a month or so, and they would be checking the BP. I don't know how many patients turn up to that doctor in the corporates, but that's one thing which is good done by the corporates.
Got it. Great. That's all I had, Dr. Dhall. Any last seconds of wisdom for a golden heart?
Oh, you should eat everything. You should eat in moderation.
Right.
And enjoy life as the best. That is my words.
Well said, Dr. Dhall. Thank you so much for being with us today.
Thank you
For
very
our
much.
lovely audience, thank you for joining us on the 11th episode of Conversations with Zyla. I hope this was as enriching and as wonderful as it was for me. Dr. Dhall, it was wonderful hosting you. We look forward to seeing you again. Thank you so much.
Thank you very much.
See you again next time. Until then, goodbye.